Page 106, cold clues. For many years, there was no way to study the virus called the Spanish influenza. The mystery was what had made the disease so deadly was buried along with its many victims. Then in 1950, the researchers at the University of Iowa got the idea of looking for the virus in the Alaskan permafrost. John Hilton learned that an isolated village in Alaska, Bravery Mission, had been almost entirely wiped out by the Spanish flu. 72 of the 80 residents had died in 1918 and were buried in a mass grave. John realized that the bodies might be preserved in the permafrost. If he could get a tissue sample from one of the victims, it might be possible to isolate the virus that had killed them. John got the permission of the village elders to open the grave, and he traveled to Alaska to start digging. He recovered frozen tissue samples, but to study them, he had to get back to his lab in Iowa. He started a long trip home, stashing his precious samples in airport refrigerators and hotel freezers in between flights to try to keep them from thawing out. By the time he returned, the samples were ruined, and he was not able to extract the virus. With no money to return to Alaska, John was forced to give up the dream of solving the mystery. John was already retired in 2005. He heard about the research team that had developed a new method to isolate genetic material from tissue samples. He leaped at the chance to return to Brave Mission to finish what he started 50 years before. This time, the researchers successfully reconstructed the virus. They were able to determine that the Spanish flu was caused by an avian or bird virus, and they developed a vaccine, making the world safe for another Spanish flu pandemic. Lessons from the Spanish flu. More than 100 years after the end of the worst pandemic in history, scientists are still studying the records of the Spanish flu to understand how it spread so fast, so fast, and what worked to slow it down. There was no effective treatment, so controlling the spread of the pandemic depended on the epidemiologists, now called non-pharmaceutical interventions, or NPIs. These are the things like staying home, washing your hands, stay a safe distance from others when out, wearing a mask, and avoiding large gatherings. In early 2020, as COVID-19 infections spread around the world, public health officials told people to follow the same rules that had worked in 1918. But no vaccine or cure for COVID-19. NPIs were the best way to stay safe. Schools and businesses closed. People stayed home, going out only to buy food. But not everyone agreed on how long it needed to continue. Did the experience of cities during Spanish flu offer the answers? Epidemiologists who have studied the data from the 1918 agreed that timing was important. Cities that acted fast to shut down placed their people gathered, such as churches, theaters, and schools, had lower infection rates and fewer deaths. But when those cities relaxed the rules, influenza came back. Scientists compared the epidemic curves of different cities during the 1918 pandemic, noted that in places where people continued to practice social distancing, there is no second wave of infections. No conclusion. The key to surviving the Spanish flu was to go home and stay home. The start of something new. The huge number of people who were infected and killed by Spanish flu convinced health officials and governments around the world that they had to make changes to the way medical care was delivered. At the time, most doctors worked for themselves or for charities or religious organizations. They weren't required to report cases of diseases to authorities. So there wasn't an easy way to tell that the pandemic was coming. Over the next few decades, country after country started offering their citizens free healthcare or socialized medicine. Norway was the first, followed by countries like Japan, New Zealand, Britain, France, Germany, and Canada. The spread of the flu across the globe provided that international cooperation and was needed to control diseases. So in 1919, when the first International Bureau for Fighting Epidemics was formed, it was eventually became known as the World Health Organization, which in 2020 took the lead in the fight against COVID-19. Look back onto page 108. Social distancing. A new idea, an old idea is new again. In 2005, a new book about the Spanish flu pandemic was published called The Great Influenza. It told the story of how the virus spread around the world in the final years of World War I. Headed off for vacation that summer, the President of the United States, George W. Bush, tossed The Great Influenza into his suitcase, thinking it would be an interesting read about a long time ago. Instead, that summer's reading got him thinking about the future. President Bush came back from vacation and told staff that they needed to start planning. How would the United States handle a future pandemic like the Spanish flu? The answer, it turned out, was not new. The scientists who were called on to come up with a plan used modern science to prove that social distancing method first used in the Middle Ages, like quarantine and self-isolation, were the most effective ways to prevent the spread of the illness. These days, many people expect that whenever you get sick, their doctor can prescribe a drug to cure or treat the illness. It seems like, with the advice to just stay home, medical science was taking a step backwards. But in fact, scientists were applying lessons learned from the Spanish flu epidemic and using state-of-the-art computer modeling to prove that social distancing works. Now turn to page 110. A good host. The Spanish influenza was a strain of avian or bird flu that spread to the human population. Wild aquatic birds are the host species for avian flu. The virus occurs naturally among them. Occasionally, an infected wild bird may spread the disease to a domesticated bird, like a chicken, duck, or goose. From there, it can make a leap to people. Many flu epidemics have started where people lived in crowded conditions and in close contact with poultry. In 1997, a type of bird flu spread from nearby poultry farms in Hong Kong, China. Public health officials worried that another lethal influenza pandemic might start, killing all the poultry in Hong Kong and the surrounding areas, as many as 1.5 million birds. In 2003, the bird flu came back. There were small amounts of highly pathogenic avian influenza, commonly known as H5N1, in China, Korea, Vietnam, Japan, and Thailand. But only people who were in direct contact with poultry became sick. The World Health Organization reported that by 2020, there had only been 861 confirmed cases of H5N1 in people and 455 deaths. But will the virus mutate and spread from human to human, starting yet another pandemic? That is the question that worries scientists.